Welcome to A to Z Nursing Vlogs. This video is a short view of admission and discharge procedures and the roles and responsibilities of a nurse. To introduce the terms admission and discharge, an admission refers to the official entry of a client into a healthcare facility, and transfer is moving a person from one room to another, from one department to another, or from one healthcare facility to another. Likewise, discharge refers to the official departure of a person from a healthcare facility. These processes can be impactful and disruptive to a client's normal routine. The good news is that as a nursing person, we can help the client feel less overwhelmed as they check in and check out of the healthcare facility. Isn't that amazing? Let's dive into the topic for more details. To begin with, let's see what is admission of a client. An admission occurs when a medical decision for the need for patient care is made by an appropriately qualified decision maker. A patient is accepted by a hospital inpatient specialty service for ongoing management, and the patient is administratively admitted to the hospital. The definition of admission goes like this. Admission is receiving a patient to stay in the hospital for observation, investigation, diagnosis, treatment, and care. Let's see the procedures that are taken place during the process of admission step by step. It starts with the reception of the patient in the outpatient department in an appropriate manner. Then it is followed by the recording of the social and medical data by the clerk in the records section. The patient's age, sex, religion, occupation, income, marital status are some of the data that are taken. Next, it is followed by a medical examination by the doctors, in which thorough examination of the body from head to toe is done to diagnose the disease. Physicians also write investigations and prescriptions. Next, the patient is sent or the relative is sent for making admission card, and physician prepare the patient file and send it to ward. The next ongoing events takes place in the inpatient department. Patient who is suffering from mild ailments are sent to home, and others are admitted to the hospital ward for the treatment. Clients are shifted to the ward by wheelchair, or he can go himself. A female patient should never be left with a male attender. The client is received by the ward sister. The ward in charge or nurse admit the client and also introduce herself to patient and relatives. It will establish effective nurse-patient relationship. The patient's record is then prepared. Do not forget to check the admission concerned. It is duly signed by the patient or by the relatives. A suitable bed is assigned for the patient. The patient's vital signs, weight are checked and recorded. The care of the valuables and clothing is very important. Encourage the patient to send the jewelry, money, and other valuables to home. The next important duty is to send all the samples for investigations and follow doctor's prescriptions. Next, we'll move on to the discharge of a client. Discharge is the formal release of an inpatient from an acute care institution after a period of hospitalization. It includes deaths in the hospital but excludes same-day separations and transfers to other care units within the same institutions. A discharge process can be defined as a discharge planning is a centralized, coordinated, multidisciplinary process which ensures that the patient has a plan for continuing care after leaving the hospital. Here are the list of points which are to be considered when a patient is discharged. A suitable day is fixed for the discharge according to the doctor's written order. Inform to the patient and the family members. Nursing procedures which the patient may continue at home should be taught to the patient or any member of the family. Explain the treatment, diet plan, exercise, and medication according to the prescription. Watch the reaction of the patient about discharge. Return all the client's personal belongings such as clothing, money, and other valuables. She should get a receipt from the patient at the time of delivery of valuables. Check and receive back hospital properties before patient leave the hospital. Nurse should confirm that the patient had paid all the hospital bills. Send the patients with discharge paper and follow-up paper. If the client is not able to walk, then the patient is safely transferred in wheelchair or stretcher up to the front door. If any patient leaves the hospital against the medical advice, he should be asked to sign a release form. The nurse should see that all charts and records are completed and sent to the records section. These are the basic steps that are followed during the admission and discharge procedures. Thanks for watching. If you find this video informative, like it, share this with your friends. Comments are welcome for more improvements. Subscribe the channel for more videos and updates. Please don't forget to click on the bell icon for more notifications. Thank you.